RetinaRounds, episode number 48, Transcorneal Vitrectomy. In this episode, guest surgeon Dr. Nagiel demonstrates the use of a transcorneal approach to treat a retinal detachment in a patient with regressed retinoblastoma. Now, you may be wondering why take a transcorneal approach. Well, even in patients with regressed retinoblastoma, one concern is that entry into the eye through the uveal tract may allow for seeding and dissemination of potentially viable retinoblastoma cells. So accessing the posterior segment through the cornea circumvents this issue. Let's check out the steps of this approach. First, we'll show you a video from another patient demonstrating transcorneal trocar placement. So we're showing you this to you at half speed. Here, a radial approach is taken with the trocar placement. You can see that trocar, a 23 gauge trocar, is being placed proximal to the limbus in a radial fashion, and a twisting motion is used to allow the trocar to gain entry into the anterior chamber. Then the stiletto is removed and 2 additional trocars can be placed. Now we'll show you the video for the patient in this case. You can see that the 3 trocars have been placed and a 23 gauge cutter is being used to perform a lensectomy. Now, once the lensectomy is performed, the instrumentation can then be directed towards the posterior segment to perform the retinal detachment repair. And you may be wondering, how is it possible with, in a pediatric eye where the instrumentation is already fairly crowded, then to also take a vertical approach and still maintain wide-angle viewing? Well, typically wide-angle viewing is going to be achieved with the Zeiss 128 diopter lens. However, in this particular case, because of the transcorneal approach and because it's a pediatric eye, the vertical approach is going to be too difficult. Those instruments will bump up against the side of that Zeiss wide-angle lens. And so instead, Dr. Nagiel is using the Oculus Versa HD lens. And you can see here that the sides of the lens are almost chopped off. And so that allows for the instruments, both the light pipe and the cutter, to be angled more vertically to be able to perform the surgery. Now, the wide angle viewing is limited to the axis of the lens itself, and so to gain wide angle viewing in different quadrants or in different clock hours, the lens does need to be rotated. But this particular lens does allow for a more vertical approach. So going back to the vitrectomy, this is going to be a pretty standard approach. A posterior vitreous detachment has been induced and the peripheral vitreous is shaved back. The lens capsule is now being removed using a max grip forceps. And you can see here that inferiorly, proximal to the infratemporal arcade, there's the regressed retinoblastoma, and there's a break here that's located more temporally. Through that break, subretinal fluid is drained. Laser is applied around the retinal break, and 360 laser is also performed to provide some additional support. In this case, silicone oil is being implanted, and an inferior peripheral iridectomy is performed. Here we'll show you closure of the trocar wounds in a different patient. In this case, a 10-0 vicryl monofilament suture is being used parallel to the limbus to close those radial wounds. And the benefit here, of course, of using the monofilament vicryl is that it dissolves on its own in a pediatric patient, circumvents the need for having to remove the sutures. And the eye is rinsed with balanced salt solution to lyse any potentially viable retinoblastoma cells. Here are some points of discussion with respect to transcorneal vitrectomy in patients with regressed retinoblastoma. Now, there are increasing globe salvage rates in eyes with regressed retinoblastoma, and this has resulted in a number of indications for performing vitreoretinal surgery. And these can include tractional retinal detachment, rhegmatogenous retinal detachment, vitreous hemorrhage, vitreous opacities, and or white cataract. In this particular case, Dr. Nagiel demonstrates the use of a transcorneal approach for the management of a rhegmatogenous retinal detachment. Now, scleral buckling can be employed in some cases. However, I think you can appreciate from the surgical video that there was significant vitreous haze, and that really precludes good visualization of the retina and particularly visualization of the retinal break. And that makes vitrectomy a more desirable surgical approach for this patient. Now, again, one of the drawbacks of performing a pars plana approach is that access through the uveal tract does create the potential for seeding of viable RB cells and the potential for dissemination. And some surgeons use chemotherapeutic agents in the BSS bottle to mitigate this risk. However, there are downsides to using these chemotherapeutic agents, including potential risks of ocular toxicity and exposure to operating room staff. Now, a transcorneal approach avoids the uveal tract altogether, and so that circumvents the need for using chemotherapeutic adjunctive therapy. It also avoids the need for cryotherapy, which would be used in scleral buckling, and cryotherapy can increase the risk of inflammation. So the surgical technique shown here can be performed with either a 23 or 25 gauge instrumentation, and is best performed again with the Versa HD lens, because it allows for wide angle viewing while being able to keep the surgical instrumentation vertical in a relatively crowded space. One downside of this approach, however, is that it does require a lensectomy, and that sometimes needs to be performed in patients who have a clear lens. So thanks again, Dr. Nagiel, for sharing this very innovative approach to pediatric vitreoretinal surgery, and we'll look forward to hearing more about the long-term safety and efficacy of this technique. If you enjoyed this video, please visit us at RetinaRounds.com. There you can sign up for our email list. You'll get a notification every time a new video is posted. And if you have an interesting video or a tip or trick that you'd like to share, please follow the links on our website, and you can upload your video there. Thanks so much for watching.